Assalamu alaikum. My name is Nabiha Iftiaq and my department is BS Biotechnology. Today, the topic of my presentation is codeine. First of all, we will look to the contents. First is introduction of codeine. Second, preparation method of codeine. Third, properties of codeine, which includes physical properties and chemical properties. Fourth will be the uses of codeine and the effects of codeine. Fifth will be the summary. So we will start our topic with the introduction of codeine. Codeine is derived from morphine, an opioid analgesic, or codeine is the naturally occurring enantiomer of polycyclic alkaloid found in the opium poppy. Codeine is a drug of morphine used to treat pain, coughing, diarrhea. This opioid is commonly used in combination with other drugs for making cough relief medications. Codeine has weaker analgesic and sedative effects than the parent molecule, which means that morphine has more powerful, more stronger effects than the codeine. Codeine is also used in a very wrong way when it is available. Codeine misuse has emerged as a concerning public health issue due to its associated adverse effects such as headache, nausea, vomiting, and hemorrhage. It is very important to develop reliable analytical techniques to detect codeine for the both quality control of pharmaceutical formulations and identifying drug misuse in the community. Now we will look to the preparation method of codeine. Codeine is called methyl morphine, naturally occurring alkaloid of opium. Codeine was first isolated by French chemists in 1832. Codeine may be extracted directly from opium, but most of the times it is produced from morphine, that is another derivative of opium. Because of its neurocative effects, the distribution of this drug is controlled by various governmental agencies. Now we will look to the process of preparation of codeine from morphine that comprises the following steps. The first step for the preparation of codeine from morphine is reacting morphine with the methylating agent in the presence of hydrocarbon solvent at temperature of 100 to 215 degrees Celsius, which means when morphine is reacting with the methylating agent, hydrocarbon solvent is present over there and the temperature required for the reaction is 100 to 215 degrees Celsius. Under reflex conditions such that approximately 50% or more of the hydrocarbon solvent is returned to the reaction mixture to sustainably avoid the formation of codeine methyl ether. The second step is recovering codeine from the reaction mixture. The process of recovering codeine from reaction mixture is the process may include step 1 above, followed by step 2, cooling the reaction mixture to approximately 85 degrees Celsius and adding water to terminate the reaction. The third step for this process is raising the pH of reaction mixture to approximately 11. The fourth step is separating the hydrocarbon solvent phase containing codeine and dimethylaniline. The fifth and the final step for the process of derivation of codeine from morphine is adding a dilute mineral or organic acid and approximately 6 to 7 times the volume of water for each of hydrocarbon solvent to separate dimethylaniline and codeine. Now we will look to the properties of codeine. First, we will see the physical properties of codeine, which includes that codeine appears as colorless to white crystalline solid or white powder. The appearance of codeine is usually colorless, and if it is has a slight shade of white crystalline solid or a white powder. Codeine sublimes at 284 degree Fahrenheit. Codeine is odorless. It has bitter taste. The melting point of codeine is 154 degrees Celsius and the boiling point of codeine is 460 degrees Celsius. Now we will look to the chemical properties of codeine. The molecular formula of codeine is 618H21NO3. The molecular weight of codeine is codeine base anhydrous 299.36, codeine base monohydride 317.4. The structural name of codeine is given over here and the structure of codeine is given at the corner. There are many uses of codeine, and these are described over here. Codeine is used as a central analgesic, sedative, hypnotic, antinonceptive, and peristaltic. It is also recommended in tuberculosis and insomnia due to incessant coughing. The patients of tuberculosis face a lot of coughing due to the damage in their throat. So, codeine is recommended to them because codeine affects the part of the brain that causes coughing and reduces the cough. Codeine will help relieve symptoms but will not treat the cause of symptoms or speedy recovery. When codeine is used to treat pain, it works by changing the way the brain and nervous system respond to the pain. It means that codeine works by playing in brain and nervous system. The part that respond to the pain, it will affect on that part. When codeine is used to reduce coughing, it works by decreasing the activity in the part of the brain that causes coughing. As I already said that it decreases the activity in the part of brain that is producing cough. The literature information related mostly to determination of codeine active components using gas chromatography, capillary electrophoresis, thin layer chromatography. This contribution provides a comprehensive review of its analytical and pharmacological profile of codeine. Now we will talk about the side effects of codeine, which includes headaches, stomach pain, difficulty urinating, dry mouth, vomiting. These are minor side effects of codeine. Now I will tell you some major side effects of codeine, which are hallucinations. It means that seeing things or hearing voice that actually does not exist. And other also major side effects of codeine are fever, sweating, confusion, fast heartbeat, shivering, sware muscles, stiffness, loss of coordination, and changes in heartbeat. It is very harmful when the heartbeat changes and you lost the coordination and you are sweating and you are facing fast heartbeat, shivering, and sware muscle stiffness. This is very harmful effects of codeine. Other harmful effects of codeine include rashes on the body, itching on the body, your vision changes, you get seizures, you get nausea, vomiting, you face loss of appetite, you feel weakness or dizziness, you have noisy or shallow breathing, you feel difficulty in breathing and swallowing things. Symptoms that are caused by the overdose of codeine include following. That is difficulty in breathing. When you take overdose of codeine, you feel difficulty in breathing, you have a slow or shallow breathing, you feel excessive drowsiness or sleepiness, or alternate to this, you cannot sleep, you are always awake, you lost your proper cycle of sleep, loss of muscle tone, cold and clammy skin, you feel fainting again and again, you feel dizziness, and your heartbeat gets slow. Summary of this topic is that this information on codeine tells the properties of codeine. This also informs us about the derivation of codeine from morphine and tells the uses of codeine as a pain reliever on one hand, but on other hand it causes bad effects also on the health of and it chooses for a long time also. And another drug that can be used as side of codeine is hydrocodone, which is sometimes used on replacement of codeine. But hydrocodone is more effective than codeine. Its properties of pain relieving are more than codeine. It is also used when codeine is not available. This was all by my side, and this was the all information that I could get for codeine. Thank you.